Reducing ultra-processed food intake at the population level requires bold, multifaceted public health policies because the overconsumption of these foods is not simply a matter of individual choice. It is shaped by pervasive environmental, economic, and social forces. Ultra-processed foods dominate modern diets due to aggressive marketing, convenience, low cost, and engineered palatability. Left unchecked, their widespread consumption contributes to obesity, metabolic syndrome, cardiovascular disease, diabetes, cognitive decline, and even mental health disorders, creating a silent epidemic that begins in childhood and accumulates across the lifespan. Public health interventions must therefore target structural drivers of consumption while simultaneously encouraging healthier behaviors, or the long-term burden of chronic disease will continue to escalate. One widely discussed strategy is taxation on ultra-processed foods, particularly sugar-sweetened beverages, packaged snacks, and fast foods. Evidence from countries implementing sugary drink taxes, such as Mexico and the United Kingdom, demonstrates that even modest price increases can reduce purchase frequency, particularly among lower-income populations who are disproportionately exposed to these products. Taxation can be designed progressively to target the most harmful products and generate revenue that supports nutrition education, school meal improvements, and subsidies for fresh produce. However, without careful policy design, taxes risk being regressive or insufficiently large to shift behavior. The warning is that inaction allows cheap, hyperpalatable processed foods to remain the default option for millions, especially in low-income and marginalized communities, perpetuating health disparities across generations. Clear and standardized labeling is another crucial tool. Front-of-package warnings, traffic light systems, or nutrient profiling can help consumers quickly identify foods high in sugar, sodium, and unhealthy fats, promoting more informed decisions at the point of purchase. Research shows that consumers are more likely to avoid unhealthy products when labels are simple, prominent, and easy to interpret, particularly for parents choosing foods for their children. Without mandatory labeling, misleading marketing continues to normalize ultra-processed foods and obscure their health risks. Poor labeling allows companies to exploit cognitive biases, packaging convenience, and taste as health or lifestyle benefits, which contributes to chronic overconsumption across all age groups. Schools represent a critical arena for intervention. School-based programs that regulate food availability, provide nutrition education, and incorporate hands-on learning about cooking and whole foods can dramatically influence eating habits from childhood through adolescence. Policies that limit vending machine access to sugary drinks, ban highly processed snacks from cafeterias, and prioritize minimally processed meals help establish a baseline of healthier dietary norms. However, inconsistent enforcement, lack of funding, and entrenched contracts with food suppliers often limit the effectiveness of these programs. The warning is stark. Without robust, standardized school interventions, children continue to internalize processed food preferences, establishing early neural and behavioral patterns of reward-driven eating that persist into adulthood and elevate lifelong risk for obesity, metabolic disease, and cognitive decline. Urban planning and environmental interventions are less frequently discussed, but equally vital. The physical and economic food environment shapes daily choices. Neighborhoods saturated with fast food outlets, corner stores stocked with packaged snacks, and few grocery stores carrying fresh produce create structural dependence on ultra-processed foods. Zoning regulations that limit the density of fast food establishments, incentivize supermarkets and farmers markets, and create pedestrian-friendly access to fresh food sources can make healthier choices more feasible. Public spaces that support food literacy programs, community gardens, and local farmers' initiatives provide both access and education. The warning here is that without intentional urban planning, the default environment continues to favor processed foods, normalizing overconsumption across all ages and socioeconomic groups, while reinforcing disparities in health outcomes between communities. Together, these policy approaches, taxation, labeling, school programs, and urban planning, can create a systemic shift that reduces ultra-processed food intake and improves population health. Yet, the evidence also warns that partial or poorly enforced strategies are unlikely to be sufficient. The pervasive availability, aggressive marketing, and engineered palatability of processed foods mean that without strong, coordinated public health action, overconsumption will continue unabated. The long-term consequences are grave: escalating obesity rates, rising prevalence of diabetes, metabolic syndrome, cardiovascular disease, mental health burdens, and premature cognitive decline. The stakes are high, and inaction or insufficient policy intervention risks leaving millions exposed to decades of preventable harm, while the structural drivers of ultra-processed food consumption persist unchecked. Public health strategies must therefore be comprehensive, persistent, and equity-focused if they are to meaningfully reduce exposure, reshape dietary patterns, and protect health across the lifespan.